Diversity and representation in the health workforce makes a huge difference for our patients.
This is about improving the health of the public. That's why we do these sorts of programs.
Physicians of color were just pretty much invisible. I didn't see very many of them, at all. That's when I really got involved with pathway programs way back in 1989.
They let us shadow pharmacists. That was my first time in the pharmacy world. And after that, I just was super sure that I wanted pharmacy.
Without this program, there's no way I would have actually applied to medical school or become a physician. And I truly believe that.
I'm a product of pathway programs, and with MMEP, now SHPEP, really being one of those pivotal moments for me, that turning point for me of saying, not only can I pursue a career in the health professions, but I can become a leader amongst my cohorts.
SHPEP gives this population of minority students the first step that they can have to keep advancing in their career.
I can think of a couple of folks who were part of the earlier programs who were migrant farm workers. They would wake up at 4 a.m. and work a couple hours and then go to medical school. And one of them is now the director of cardiothoracic transplant surgery at UMass. His dad had severe congestive heart failure. That was his motivator. Our program basically said, no, you can do this.
SHPEP can prepare resilient students to become health equity advocates for their community.
The program works in a lot of ways. I'm sure ways that Robert Wood Johnson Foundation didn't anticipate it. One of the things that students experience is they get that sense of belonging.
Having real doctors and faculty members say, we actually need you to be part of the medical community was a life-changing thing for me.
Look at the investment that we did in upstream here at the Pathway program. Just seeing what these students become is just amazing.
The biggest thing I look forward to is seeing how scholars who have experienced this program make a difference in their world.
One of my goals is to pay it forward by encouraging more students to pursue STEM education and health professions.
Creating those leaders who will create the change is one of the things that SHPEP, I think, has done so well.
As the leaders change and the diversity of the leadership changes, the thought processes of leaders change.
The SHPEP program is fueling the pathways so that we can have a more diverse healthcare workforce so that our patients do have those better outcomes.
Not only become incredible physicians, but they also are leaders in their societies, leaders in their organization, leaders in their community.
To see and help people's dreams come true in that way and understand the impact that they're going to have back in communities is just the best.